Good afternoon, everyone. Welcome back to another episode of Mind Split Cafe. My man Matt, what's going on
What's
today?
going on, good people? How are you?
Yeah, hanging in there. Man, today we actually have a colleague of Dr. Fodi who was on our show a couple weeks ago.
Shout out to
Uh,
Dr. Fodi.
yeah, no
Woo,
kidding.
Dr. Fodi.
With his book release and everything, he's doing well.
Yes.
Yeah. I saw he
Yeah,
posted on LinkedIn. He was like, man, was on my podcast and garnished a bunch of views. Definitely because of Dr. Fodi.
yeah,
And
no kidding. His
the
episode
book
did
came
really
out.
well.
Like he's killing it. Next thing you'll know, we'll see him on the red carpet, So
Well,
Absolutely.
well, we want to try and get Dr. Papia there as well with him, so that's why we brought her on today. Dr. Papia.
Appreciate it.
Yeah, do you want to introduce
Hello.
yourself, kind of run down your credentials and what you want to talk about today?
Yes, absolutely. Hello, everybody. I'm Dr. Ginamarie Papia. Yes, I am a colleague of Dr. Michael Fodi. We actually met in residency. He's one of my good friends. My credentials, I am an osteopathic physician and an integrative medicine doctor, but my general training is in internal medicine, and that's where Michael and I met. And I did my internal medicine residency in Greenwich, Connecticut with Michael. And then after that, I did further training in integrative medicine at Northwestern in Chicago. And for those of you, I get a lot of questions about what is integrative medicine? What does that actually mean? It basically means that I bring together all different types of healing modalities when I see patients. Really mind, body, spirit, which is a tenet of osteopathic medicine. And you name it, we try to incorporate it into our visits.
wow.
So you kind of have like a holistic and a medical approach to it, correct?
Mm-hmm. Yep.
That's
Nice.
interesting.
But I won't hold that you went to Northwestern against you, so I'm just saying, like, anyways. No, I played Northwestern in the late 90s and we barely lost. So yeah. So, anyways.
It's
But,
a little sour still.
Yeah, a little sour.
Yeah.
Right.
What is that, like
Just a smidge.
15-year
Just a
grudge?
smidge. Yeah. But I heard it's a good school. So yeah.
I was in the hospital system, so I was in an outpatient clinic, so not the actual college.
Oh,
It was like the integrative medicine center, like associated more with the hospital than the school.
Yeah.
Well, I like you then. Yeah, you're good.
Okay.
So you're cool now. You're good.
Flying under the radar.
Yeah. Yeah.
Yeah. So what do you want to start with? We have so many things to unpack with this topic and with you. So what do you want to start with?
What would I like to start with?
Yeah, let's go.
I think first, the thing that I really want to talk about and get out there is really a little bit more about integrative medicine and why that's so important to me. I'm just going to share a quick story of how
Please do.
a person goes to medical school, right, and then decides to do integrative medicine. Before I went to medical school, I was in college. I was going to be an interior designer. Clearly, I did not become an interior designer.
Yeah, that's a big difference.
So it's like
You go from interior design to
Polar
internal
opposites.
medicine. So I mean,
Yes.
it's kind of like you're working on the insides either way.
Yeah.
So there you go.
It's true. And a lot of the things that I learned in that, because I did a year of design, it was like an architecture, interior design kind of 1 year. Everybody was in one course.
Okay.
And I'll never forget, they talked about structure and function being like interrelated. And that's a concept that literally comes up in medicine, where they say like the structure of the body informs the function. So I'm like, wow, that's so interesting, like that kind of parallel. Yeah.
Yeah.
Very interesting.
Hot.
Yeah, it's really cool. So anyway, decided to go to medical school. But when we're pursuing pre-med, I was actually thinking about going to acupuncture school, which would have been more kind of holistic, learning traditional Chinese medicine. And at that time, we saw an acupuncturist that really helped my mom when all the different doctors we went to couldn't figure out what was going on with her. She had this rash that would not go away. They tried every medication you can imagine, every different treatment modality, couldn't figure out why it was happening, but it was interrupting her life so much that she would just cry because she'd break out in hives, nothing would help, and it just really kind of destroyed her life for a few months.
Wow.
It was terrible. So we were recommended to go to this acupuncturist that was almost 2 hours away from our house, but they were like, you need to see this person. He's fantastic. We went there. I'm not even exaggerating. Within like 5 minutes of him seeing her, he's like, you are allergic to sulfur and you have too much sulfur in your body. And she was like, what are you talking about? He goes, are you allergic to sulfur? And she said, yes, I'm allergic to sulfur. It's in antibiotics, but I haven't been taking anything that has it in there. Anyway, how he figured this out was he did kinesiology testing. I don't know if you've ever seen this, where they'll put like a bottle of vitamins or something in your hand, and then they measure the strength of your muscles. Have you seen this?
I've
No,
never
that's
seen this. No.
interesting.
This is
It looks like some Harry Potter stuff. I'll tell you right now. Okay.
Okay.
He does this testing. He does some acupuncture. He puts her on this like very bland diet. I think she ate cauliflower and pasta for like a week. Within like a couple of sessions, gone, completely gone, resolved. So at that point, I was like, wow, like this guy's like healing people. You know when you go to the doctor and they like give you medicine, it kind of like goes away, but like not really. This guy was like healing people. So I knew that there was like something else. Like there are all different healing modalities. I was starting to realize that were out there, and I wanted to know more about that. It was like really fascinating.
Now let me ask you this, because and so I just asked the dumb questions because I don't have like a form.
I love all questions.
Right?
Yeah.
But so how accepted is holistic medicine from like the more clinical scientific side? Like, because holistic medicine is more of like, I'm just assuming it's not really welcomed, I guess, because there's so much science behind. So you experiencing it with your mom firsthand, and you're like, hey, we've done everything science wise, they can't figure it out. We go to this holistic doctor and he figures it out in the first hour.
Right.
And now you've kind of taken this path to where you're combining both of them, right?
Right.
How are your colleagues on the scientific side? Like,
good question.
Is it
Great question. Great question.
Or do they look at you? Do you sit at the table in the lunchroom by yourself? Like, how does that work?
Thanks for Mike Fody. I never sat by myself with lunch for lunch.
Yeah.
Very accepting. But that's a fantastic question. I would say more now because I have chosen the people that are around me.
Okay.
I'm around people that are a little bit more open-minded, but definitely going through training. I'm pretty sure the people that were running my residency program thought I was like a little crazy and a little bit out there because it's not as accepted. But when you start, and the argument that they'll give is that we practice evidence-based medicine. And so what does that mean? That means we've done these, what they call randomized control trials, where they put like a drug up against like another variable, like a control.
Or whatever.
Exactly.
Yeah.
So they're measuring all these things out. So you can do that with drugs that are going to pay a lot of money because you can patent them and make a lot of money. So they're going to throw tons and tons of money at that for pharmaceuticals that they can make money for things like vitamins and natural supplements that you can't patent because it's literally a plant, that the power of those studies become difficult. But that's not to say there aren't studies. Like if you look, there are actually a lot. They're just not as big as the pharmaceutical trials.
That's interesting. I did not even think of that.
Yeah.
Interesting.
And the other interesting thing is too, like that's just looking at natural supplements, and that's just one part. But when you look at something like yoga's been studied with everything you can imagine. Yoga's been studied in depression, mental health, breast cancer, you name it. But a thing like yoga, like how do you blind yoga, right? Like it would be difficult to blind it and it's very hard to do procedural stuff in the same way you do a randomized controlled trial. So we're talking about two totally different things.
It's really hard to put an ROI, so to speak, on yoga. Like, what is the result of, it's really, really difficult.
Yeah, that actually has my brain over here thinking that's an interesting thought.
Yeah. And they'll do like acupuncture studies where they do acupuncture versus what they call sham acupuncture. So they don't actually like put the needles in, or they put them in weird places. But again, like how would you can't blind someone so that they know or they don't. Like you're going to know you're having acupuncture done. Yeah. And what is the kind of placebo effect of going through that whole process, there's a lot of variables.
Yeah,
absolutely. So I have a question, and this might be a loaded question, but when in holistic medicine, you mentioned vitamins, natural supplements, natural herbs, things like that are what's most effective, or at least what's most looked at. So there's a natural herb in my mind that I'm about to say that I believe does help, but in moderation, but I also believe that it does provide opiate withdrawals if taken too long. It's been used in Southeast Asia for a long time for pain, all kinds of things. And
Okay.
it's kratom. So kratom is an opiate-like substance. It's in the coffee family, and it's an
Okay.
extract. So it's grinded up tree leaves kind of thing.
Okay.
And it helps with pain in high doses. It's supposed to be like a sedative. In low doses, it's a stimulant type.
Okay.
So have you heard of that? And what are your
I
thoughts on
haven't.
that?
I
Okay.
haven't heard of it. How did you come to that? Come to find it?
So I obviously being in mental health and substance abuse, there's a lot going on. A lot of opiate addicts have used kratom to curb the withdrawals, but then in turn
Okay.
end up just getting addicted to kratom because it has opiate-like properties, works off the same receptors, has the same withdrawals, just not to the same magnitude.
Very
So,
interesting.
yeah, I wanted to get your thoughts on that and from a holistic standpoint, but we can table that. And when you come back on with
Yeah,
Dr. Fody in June,
yeah, when
we
she
can talk
comes
about
back.
that.
Yeah, exactly.
Yes,
When she comes back
I'll do
next
some
time.
research. I'll do some
Yeah.
research. There's so
Yeah.
many. When you start to dive deep, there are so many different herbs, and it's a very cool field because it's a lot of the medications we use today started out as like plants. They were plant medicine used for like thousands of years, and then
Yeah.
a pharmaceutical took that company took the compound, changed it in a way where you can patent it, and then developed a lot of different medications from that.
Mm-hmm. Yeah,
Yep.
don't get me started on Big Pharma, but
Yeah. Yeah, I got a
you
bone
know,
to pick with
who
that
who
too.
do we have on that mentioned it where I think they were talking about the marketing side of Big Pharma, and I don't want to get
Dr.
into that,
Weiner, yeah.
but someone told me how many times when you see a pharmaceutical commercial and they spend billions on advertising on your networks, right? But for they spend billions, and then every commercial was like, hey, talk to your doctor, or or ask for this by name, or whatever the ending is. And someone was there was a panel that was, or a study that was asked, like, how many people were actually going to the doctor and asking for the medication
Yeah,
that you see
it's a
on the
great question.
commercials.
Yeah.
And it's very very minute. Like, people don't really do it. And somebody in the C-suite at a pharmaceutical company was like, why are you spending billions on advertising? And they said, well, look, if I'm spending billions with this networks, whatever, then they're likely not going to bite the hand that feeds them when something comes up where they're not going to do a bad story about pharma. And if they do, they're not going to do it about my company, so
Yep.
it's almost like your Big Pharma is kind of hushing the media.
That's
by
kind
just
of fascinating.
spending,
That's
So that
actually
leads me
a
into
good
my
thought.
next question, right? So you're kind of like I guess a mixture, right? Where do you kind of see yourself leaning sometimes? Is it more scientific based pharma, like medicine, or is it like, hey, you know what? There might be a holistic approach where we're going to try this first
Yes.
versus, doing the
Yeah,
more
it's a great
scientific.
question. A great question. One of the like tenets of integrative medicine is about like patient autonomy. So in those situations, I really let the patient guide me and I feel them out. What are their beliefs around pharmaceuticals? What are their beliefs around natural products? Because if you get the wrong person, somebody who doesn't believe in natural products, and I'm talking about vitamins and supplements and all this stuff,
Yeah.
their buy-in is not there, where
Yeah.
they feel like pharmaceuticals would be better for them. And I'm not anti-pharmaceutical. I work in a clinic with an endocrinologist and we see diabetic patients, and the incredible change in someone's life when they can get on the right medications, especially for diabetes, because that's a field that has developed so much in the last like 20, 30 years. It's like really cool. But like if somebody's on the wrong medications as opposed to right, they can prevent heart attacks, strokes, kidney damage, losing toes, amputations, like all that stuff can be prevented from being on the right pharmaceuticals. So I think there's a time and place, and I kind of let the patients guide me on which direction I go into.
Yeah. I like that.
I like that approach.
I was just curious, like when you're dealing with, kind of two facets of the same lane. Like, where do
Mhm.
you kind of fall in?
Yeah.
What do you kind of lean towards? So
Yeah. I
it
would
makes
say it's
perfect
different.
sense. It's kind of a
Yeah,
case by case, patient
exactly.
by patient type thing.
Yeah.
Yeah.
And it would be different like if it was for myself. For myself, because my beliefs are, I believe I would like to try more natural things first before I move on to, more pharmaceuticals and just things with higher risk, right? Like surgeries, pharmaceutical medications, a lot of them come with a lot of risk.
Yeah.
Whereas like if you can take something like a breath work practice for panic or anxiety as opposed to a medication with side effects, I want to try the least invasive, least risk first
Hmm.
before I move on.
Yeah, I like that. That's absolutely a good route, or at least in my thought
Mhm.
process. I'd prefer to do something natural
Mhm.
before I have to absolutely go to the pharmacy.
Right.
So, in the mental health field, there's a lot of, I guess, sayings or quotes that mental health is just as important as physical health. And sometimes mental health actually plays a part in our physical health. What are your thoughts on that, as far as mental health playing a pivotal role in our overall health and actually being a catalyst to a lot of our health problems and or
Yeah.
getting better?
Yeah, I love this question because this is such an important, this speaks to the whole mind body connection, right? Where if you have something going on in your mind, it can manifest in your body. And if you've heard people talk about this with like different traumatic experiences, is the best way that I can describe this. And they say how you can carry the thought processes, you carry that trauma with you. And where do you carry that? You carry that in your body. And the
Hmm.
thought processes that trauma can manifest as disease if it's not processed.
Yep.
Have you
Mm.
heard that before?
Yeah, no, absolutely, and I agree with it 100%. I mean, we kind of all, from head to toe, it all works as one, and we
Yeah.
seem to, in the healthcare field, break it up and make it different. But they all play
Hmm.
on each other. It's just like a car. The
Absolutely.
engine works on the transmission and the oil, and like it all plays a part together. And the same thing with our
Yep.
body. Everything plays a
Yep.
part with each other.
100%. They've actually done studies where they look at people who've had open heart surgery, and the people who have a more optimistic outlook actually do better. That they've been shown, like when they do these studies, that they actually do better. They heal better, they recover better. And that just goes to show you that your mindset can totally change the
Yeah.
trajectory of your health and how you recover or even respond to treatment, right?
Yeah,
I'm a,
the power
it
of the
makes
brain is
it makes
phenomenal.
perfect sense. I'm a huge believer in manifestation, and Chris knows this, right? And there's so many things that we've kind of manifested. This show is a
Is
perfect
one of them.
example of manifestation, right? Like, anyways, I could go down the rabbit hole on that, but it makes perfect sense that everything is connected, right? Because it's if you're going to have that black cloud around you or above you, following you everywhere, meaning your outlook, then you're going to have a negative experience, right? Because you are
Right.
bringing that energy from that cloud or those negative thoughts into your body, and that is going to affect your body, kind of like what you said with the car engine, right? And so it makes perfect sense if you manifest positive thoughts, or a positive
Right.
outcome, or whatever, then it's going to affect your body in the same way, right? In the same positive experience versus the negative. So I love that. Makes
To-
perfect
Absolutely.
sense.
I
Absolutely.
kind of have Matt made me think of that question coupled with my answer kind of made me think of something a little different, and I'm not sure if they play a part in each other. But going back to the manifestation of whether it's positive or a negative route, um, does neuroplasticity play a role in that? Because I mean, the more we do something, the more our brain thinks it's normal, and that's kind of where neuroplasticity comes into play. So, does someone thinking negatively, like, oh, this, I use this because I've been through it with my dad, but, oh, this cancer is going to kill me. I'm not going to make it. This treatment's not going to work.
Mhm.
I'm going to feel like crap, so forth. Is that knocking on the door of neuroplasticity saying, hey, we're changing? I'm not sure how it exactly works, but that's kind of a,
Mm.
a weird thought that just popped into my head, and I'm not sure I structured the question properly. But
I think I understand. I would say they're probably all interrelated, right? When you replay a thought over and over, you're replaying, like they say, neurons together that fire together, wire together, right? So you're replaying on the same neural paths. And when you change the way you're thinking, whether it's affirmations or, you're starting to change your perspective on things, you're changing your brain effectively, right? Meditation practice makes you step back and realize the thoughts that you're playing over and over in your brain, and then just kind of recognizing them and saying, okay, I don't want to think this negative thought over and over again. This is self-deprecating. It's not getting me anywhere. And you change your brain by replaying thoughts intentionally with intention for what you want to accomplish.
Yeah. So, and Chris knows this, I personally suffer from imposter syndrome, right? And so I have bouts like once a month, right? And up until about 2 months ago, I mean, it was bad. It was crippling. Like there was a spot every month around 2 or 3 days where I was just like done. The world was crashing down, right? And doing the show and talking to Chris and talking to clinicians and doctors and everybody on the show, Chris has helped me really like, hey, when this is coming, then you need to start thinking of, like positive thoughts. Flood your mind with positive thoughts and push out those negative thoughts, because they're not warranted, But the last 2 months I've been doing that, and right, Chris, I haven't had a real bout of, I still feel it. Like I'm just,
but you can
critical
control
of myself, right? But it is not to the point where it's crippling and it's like the sky is falling type feeling anymore. It's like, all right, well, yeah, we'll get through it if we get through it, we can, and we usually do, so.
And Matt, I don't mean this to be like a pick on you, but I think, our relationship, we can joke about this, but I always knew when it was the end of the month because I would get that phone call, the imposter syndrome phone call.
The imposter syndrome phone call is just like, you don't know.
I knew it was the end of the month.
You have so many people fooled, and it started when I started my own company, and so it's that self-analysis, that criticalness of yourself, right? Reflectiveness. It would just beat down on you. Why am I not good enough? Do I have people fooled? It was just those thoughts. It was that, that you're an imposter type thing. And I still suffer from it, but, Mind Split and Chris and people that guests have been on the show have really helped me, kind of put tools in my bag to combat those thoughts when they creep in, so it goes. I'm gonna get off my soapbox right now, but I just wanted to share that.
I just want to jump in there and say thank you, Matt. That does mean a lot. I love having you on the show, and we would be nowhere without you. So thank you. I just wanted to throw that out there and give you your flowers, because you always give flowers to everyone else.
Thank you.
And thank you for sharing that.
Yeah.
And so when I have one last question, and this may just open up Pandora's box, and I know Matt will be able to compound off of it as well. But we did a episode with a psychologist, Dr. George, at the university, actually, that Matt played basketball for back home where I grew up. And he has started a kind of like a program, and I know it's done other places and maybe done a little differently, but in the Valley where he is at, it kind of hasn't really been done. And what he has done is kind of integrated mental health into an internal medicine office. So inside the practice, the doctor goes about their daily, seeing their patients, talking to them, but they now ask mental health related questions. And when those questions, kind of like the DSM-5, if you're showing 3 of these 10 symptoms, this is what you have. So they kind of have not a DSM-5, but something similar to that. Like if you answer yes to 3 of the 8 questions, we're going to bring in the mental health provider and start your first behavioral health visit inside the clinic, which in turn helps eliminate the fall off rate of referrals. So, you get a referral and then it's on you to go set the appointment and show up to the appointment. And this eliminates a lot of that. What are your thoughts on that? And do you think it's smart? Do you think it's a bad idea? Would you want to do something like that if you were an internist and had your own practice? Let's talk about that for a little bit.
At Palms Behavioral Health, we understand the journey to mental wellness. Our dedicated team offers personalized care for adolescents, adults, and seniors. We focus on individualized treatment plans, addressing a wide range of mental health needs. Our evidence-based practices and trauma-informed care ensure sensitive and effective treatment. Palms Behavioral Health, healing minds, empowering lives. Contact us today.
So funny that you asked that. I actually have experience with this at the clinic that I worked at in Chicago. It was actually a federally qualified health center, or FQHC. And so it's a clinic for people who are uninsured or of lower economics. And we provided a lot of different services. And one of the things we did really well was mental health. Because a lot of times, if people don't have the means to pay for a therapist or any type of support, it can really fall through the cracks. So one of the things that they implemented was something they called a warm handoff. So if I was meeting with a patient and I felt like they would really benefit from having some kind of one-on-one support, whether it be therapy or something along that realm, I would send a message to our psychologist or social worker in the office, and they would come if they were free to meet the patient.
Wow.
Which was great. And
Yeah,
I loved it because anytime I start somebody on an antidepressant or I want a medication like that, I want the support of having some kind of therapy, because it's been shown that them together is so much more valuable than just sending somebody home on a medication.
Mm-hmm.
that right there, I love that you said that, because a lot of doctors, and I'm not talking crap or anything, because doctors are obviously way smarter than me. They've been through so much more schooling than me. But a lot of doctors just write the script and be on your way. Let me know if you have side effects. We'll talk about it next week. See if you like it. The dosage, we'll work with it. They do their job. But I know with a lot of psychotropic medications or medications for anxiety, depression, pain, things that have some sort of psychological effect, you're supposed to have a therapy coupled with it, such as MAT treatment. So it's Suboxone. A lot of doctors just write the Suboxone and let you be on your way.
Right.
It's supposed to be done Suboxone and therapy, because it's an evidence-based practice. And I love that you just said that, because it's only really done with Suboxone to where they make you do therapy. So I
Right.
honestly think, like, there is a reason why you're sad. There is a reason why you're being anxious. We're just masking it with the medication. Let's get to the root,
100%.
figure out why you're feeling this way,
Mm-hmm.
and why we're doing this work. The medication will help you for then.
100%.
At least that's my thought process on it.
Yeah, 100%. It's
Yep.
also when have you heard when they look at anxiety and depression compared to medications, exercise is actually performs sometimes just as well as medications.
Wow.
Yep. Yeah, and
I've heard
even
that,
changing your diet too can help.
yeah,
Mhm.
I've heard exercise has helped kind of relieve that anxiety and that stress, right? It's a stress reliever, right? But
Yeah.
my thing was I guess my approach to that was, when I played college basketball, we exercised obviously every day, like practice or
Mhm.
games or whatever. But the stress you feel as an athlete
Yeah.
to perform or to maintain your eligibility, your schedule, like classes, and
Right.
I'm not saying it's, there's a boohoo story here, but it's almost like if you're exercising every day to the level that you're, a D1 athlete is performing at, where you're 6-7 hours a day, and you still feel this stress and anxiety.
Yeah. I think there's probably a sweet spot for it.
Yeah,
And
I
I
think
would
there's a difference in that type of working out, and like working out for the joy of it or for like the health of it, versus being yelled at your coach and forced to work out. I think there's a mental difference in how your brain perceives it.
It's almost like the dog chasing its tail. Like you're working out, but you're still stressed,
Yep.
so
Right.
you're just kind of like constantly in circles,
And
right?
I can imagine that realm being very like a kind of almost like medicine, like shove it down, push through,
Mm-hmm.
kind of mind
Yeah.
over matter. Don't acknowledge the feelings. We have to perform.
Exactly. And
Yep.
there, at the time that I played, there was no mental wellness. There was no like dialogue like there is today, where it's out in the open. It's kind of like what you said, Doc. It was like push through it. Like everybody's experiencing it. It's your turn, so to speak. You'll be fine.
Dust yourself off.
So anyway, so that's kind of my approach on exercise when it comes to stress and anxiety. It's like, I don't know if it's, but anyway.
Yeah. I think usually most people, different than athletes, are sitting on the couch, not really moving around very much. And so just moving, kind of shifting the energy from like being very sedentary to moving can make a profound
1,000%.
difference.
And diet too. Like you said, like you mentioned, Chris, diet.
Yeah, and I have a question that kind of
what
plays
you're putting in your body.
Well, what Matt was saying is that his working out as a D1 athlete didn't really help with the stress. So it being a doctor, and you may or may not know this, and we can do some research on it and come back for your next episode for this question, but does the working out for the joy of it release, obviously it releases endorphins, it makes you feel good. So does the working out, being yelled at and in a stressful situation because you have to do it, you're forced to do it, you have a test coming up in 2 hours that you didn't study for, you haven't eaten lunch kind of thing, like, does that not release the endorphins that are released when working out for the pure joy of it?
I don't know the exact answer, but I would imagine being yelled at and knowing you have a test and all these things, you'd be constantly running in fight or flight. Like your adrenaline is through the roof. That's what's keeping you pushing forward.
Olympic system's on full overdrive.
Yeah, like we know that's the issue a lot of times with people who have anxiety and depression too, is like you can't shut down, you can't downshift, and everything. We're so overstimulated that you're constantly on this like fight or flight, which we weren't designed for this. We weren't designed to be up until all hours of the night and be exposed to artificial light. That's why doing things like around sleep hygiene, lowering the lights, and being exposed to natural sunlight help to like reset our circadian rhythm.
That's interesting. I like that idea. I've never even really looked at it that way. And I'm sitting here with 2 ring lights on and a lamp. And I'm gonna start sitting in the dark.
I know. My office that I work in, we don't have any windows.
So so you're like in a cage pretty much, huh?
Yes, it's pretty dark and stuff. But we acknowledge that, we know that it's not ideal. Try to go outside in between patients, things like that.
Yeah. Do y'all use direct light from like the light fixtures, or is it kind of like indirect light, like mood lighting?
I would love to have mood lighting. We were just actually talking about this. We're mostly fluorescent, but this is because I haven't been there a long time. But I was talking to my mentor that I work with. I'm like, we should get some paintings of like nature. They've actually done studies where when people are looking, like when they're doing dental procedures, if they're looking at a picture of nature, they have less perception of pain, as opposed to like modern art doesn't have that effect, but pictures of nature does. And also like you were saying, indirect lighting, like lamps, as opposed to like fluorescent overhead lighting, people's blood pressure is lower. Their overall experience is much better.
I hate fluorescent lighting. And you just increased the value of Bob Ross's estate by like exponentially. I mean, little tree here, little cloud there, like you just made his estate just really
that much more valuable.
Yeah. I would love to have a Bob Ross painting,
Yeah.
So, anyways, well, we're running out of time, Doc, and I appreciate you so much for joining this show. And this has been really, really enjoyable. And I love your approach, your kind of fused approach of holistic and scientific based. And I wish you all the best. And you're welcome back anytime you want to come back.
Thank you so much. This has been so much fun. It's like just talking with friends. We get to talk about fun topics. I love it.
And you showed us how to be invisible.
Yes, I was like...
You're going to have to teach us how to do that one. The one thing
that comes with many years of practice and skill.
I want to take that herb. Show me that herb.
What herb does that?
If I can bottle it, I bet I'd make a lot of money.
We would make a lot of money. And I know just the marketing company to help you market it. So
me too. Yes.
So thank you so much. Thank you so much, Doc. You're welcome back anytime. And until next week, guys, we'll see you soon. Have a great week.
Thank you, everyone.
Have a great